Hi everyone, my name is Christa Wroblewski. I'm a licensed acupuncturist and herbalist. I work at the Yinova Center in New York City. This video will showcase how to use acupressure for labor support. It was created in the context of COVID-19 because we are aware that many mothers-to-be in New York City and beyond may be required to give birth without a support person present. In response to this, we want to offer support and give you tools so that hopefully you'll be able to ease the pain of labor and reduce emotional distress. These acupressure points can be stimulated in a variety of different ways. If a partner is present, then the partner can press on the points for you. But if you're solo in the delivery room, these points can be self-stimulated, either just using your hands or through the use of a variety of props that we'll talk about in a moment. But it's important to note that some of these points I'm describing can promote labor. With that said, practicing location of these points prior to labor using gentle touch is okay, but any firm pressure before the laboring process is not recommended. If you have any questions about this or you'd like more guidance, feel free to reach out to us at Yinova. We're offering virtual consults right now, and we'd be more than happy to talk you through this.
So the first 2 points I'll talk about are located on or near the hand. The first point is large intestine 4. It's found between the webbing of the index finger and the thumb, right about here. So if you slide up the index finger, you'll come to a long bone in your hand. This is called the second metacarpal. And if you find the midpoint of the second metacarpal and you slide off of it towards the direction of the thumb into that webbing area, you'll find a tender depression. And I recommend placing the opposite thumb or an acupressure magnet over this area and pressing in the direction of the second finger. You'll feel a dull ache sensation when the point is properly located. And this point is so great because it promotes labor. It can be really helpful for reducing pain, but it can also help to regulate contractions. And if a mother is fatigued or no longer able to push successfully, then you can also use this point. You can use both sides. Second point is called Pericardium 6. So if you flip the palm so that it's face up and you take 3 fingers to the wrist crease of that hand and wrist area, you'll place 3 fingers there. And then you'll find the distance of that third finger, and it's between 2 tendons that are located right about there. 3 fingers, find that space right between the tendons. This is called Pericardium 6. You won't feel that dull ache sensation quite as much as you did in the last point, but this point is so good if you're experiencing any nausea, any vomiting, or any distress, emotional distress during the process of labor. We use it all the time for nausea and vomiting in our early pregnancy patients that are having symptoms of morning sickness, but also we use it quite frequently for emotional unease and anxiety. These next 2 points can both be used for alleviating pain during contractions. So the first point is called Gall Bladder 21. It's on the top of the shoulder at the highest point of the shoulder. You can take your index and middle finger and bring this hand across the chest to rest on this tender point, and then you'll press it directly downward. It should feel achy in the way that it would if you were getting a massage. And this can be used both during contractions at the start, but also when contractions become more forceful and more frequent. You just press it down in an effort to alleviate pain. And then the second point is called Bladder 32. It's found over the sacrum. The sacrum is this triangular bone. It's at the base of the pelvis. And if you trace the spine down, you come down to the bone between the 2 hip bones, you'll find the sacrum. And the point is specifically over the second hole or the second foramen of the sacrum, but you don't need to worry about being too exacting around this. You can just feel for a tender spot and then either place a lacrosse ball or a tennis ball behind you and use it to lean back and apply more pressure, gently rocking side to side with the emphasis on reducing pain.
Thanks so much for watching. I want you to know that this is not a comprehensive list, that there are many acupressure points that may be appropriate for you specifically. And if you'd like more guidance on how to use acupressure for labor support, feel free to reach out to us at Yinova and set up a virtual consult. Thank you.